Hi, I am Dr. MIRUDHUBASHINI Govindarajan from Women's Center by Motherhood at Coimbatore. Fertility is only a symptom, it's not a diagnosis, fertility or subfertility, and there is no single test either in the male or female that can tell an individual yes you're fertile or no you're not fertile. At any level, a sperm test alone is not enough to call a male either fertile or infertile, because there may be men with very low sperm count also today are able to conceive. Even some men with no sperm count are able to conceive also today. The same in women, there are many issues. In women we have to look at several factors. The factors being, is she first of all healthy? Somebody who's obese can have more of a problem in conceiving. Somebody who has medical problems such as diabetes, hypertension, such things can have difficulty in conceiving. Ovulation problems, in other words, producing an egg is what is called an ovulation problem. This happens once in a month in the middle of the cycle. So for a whole cycle, the egg is produced just on one day around mid-cycle, and if that does not happen, that cycle will not be a fertile cycle. So we have to make sure that the ovulation happens adequately. Once ovulation happens, that egg needs to be transported through patent tubes or open tubes into the uterus, and therefore you need patent tubes. That will be the next part that needs to be checked if fertility needs to be ascertained. Third part is the uterus itself, and sometimes there are problems with the uterus. There can be polyps inside the uterus, sometimes there can be fibroids or adenomyosis. Some pathological factors that happen to the uterus may be coming in the way of achieving a pregnancy as well. And cervical problems also. Sometimes the cervix is very tightly closed or has an abnormality. It does not allow the sperm to get inside the uterus and has a problem. So different parts of the reproductive system and different activities of the reproductive system needs to be checked, as well as the general health of the woman. And the same way in a man also, today are a lot of things that we have to look at. What is the kind of a job that the man has? You may be surprised to find that even jobs such as farming carry a lot of risk, because they are exposed to a lot of chemical agents. A lot of smoking makes a difference, alcohol makes a difference, and a lot of lifestyle factors make a difference also. Besides that, sexual factors also come in. So all of these things need to be looked at and investigated properly and thoroughly before you call anybody fertile or infertile. But very few people actually need to be called infertile these days, because there are very few non-reversible situations today in the management of infertility. So therefore, complete investigation should be the first step in investigating or treating a couple who want to have a child and are unable to achieve it on their own.